Welcome. You're listening to the Beyond 50 radio program, and thanks for joining us today. I'm your host, Daniel Davis. Just imagine that you live for years and years and years with chronic pain. The only thing you can seem to do is take over-the-counter type drugs that might be able to help stave that a little bit just so you can function on what you would consider a normal level. Geez, what is that normal level anyway? Well, just imagine that you just keep taking this to the point that you get onto prescriptions. Pretty soon you're injecting. I mean, where is there an end in sight to being able to feel what it felt like to be normal, to actually feel good? Joining us here on the Beyond 50 radio program is someone who did just that. He lived with 25 years of chronic pain, but discovered a way that he could get himself off of such things as perhaps aspirin, ibuprofen, whatever the case may be, even tranquilizers. I don't know. We're going to find out how he did that using neuro-linguistic programming to break the physical and emotional pain cycle. Joining us here on the Beyond 50 radio program is our guest with a new book, Release the Pain, Heal Yourself. And joining us is Mark Ribkoff. And Mark, thank you for joining us here on the Beyond 50 radio program today.
Hi, Daniel. I'm really pleased and excited to be here. It's a great opportunity to share my experiences with others and hopefully help some people to help themselves, deal with pain issues.
Absolutely. Now, tell us your story. I mean, 25 years of chronic pain. What was that like?
At some points in my life, it definitely wasn't pretty, that's for sure. It started pretty much in my teen years. I had a major collision, if you will, in sports, playing soccer with a fellow who just couldn't stay off of my back, literally. I got a knee in the lower back, and that caused a major trauma to the lower back. And, that one injury seemed to precipitate years and years of injuries that followed, and it always happened in my lower back. At times, I write in my book, I talk about, how I just became totally debilitated. And when I mean totally debilitated, I mean lying on the floor, curled up in a ball in excruciating pain, not able to move, not able to breathe. The slightest movement just sends you into a spasm of pain. And that happened on a continual basis for 20-plus years.
That's a pretty rough way to live.
It was, on one side it sounds absolutely terrible, and when you're in that moment, when you're experiencing the pain, it is absolutely terrible. But when, I did have some good days, and I had some, I've continued to pursue sports even with living with pain. The thing that happened was that I would continue to live, enjoying sports to some degree, but always, whether the pain arose during the sport or after the sport, it just, it would overtake my life. It just became, it overshadowed everything. And that was, the most difficult thing to deal with, is that it's not just one day to the next, it's 1 year to the next, now I look at it, it was decade after decade. I mean, that's not a way to live.
No, not at all. I mean, it would get to a point you realize, you wake up in the morning and think, what have I got to look forward to? Well, pretty much the same thing I did yesterday.
Right, and, depending on the day, could be even at a higher level. And that's the odd thing about that. The more I speak to people and the more I hear others' stories of dealing with, whether it's chronic pain or acute pain, is everybody has a different pain threshold, if you will, that allows them to either function or pretty much be shut down. And for each individual, it's different. And some people, their pain threshold, I guess it's like anything in life. Once you get used to it, you just feel that's the norm. And so your level of pain that will slow you down or stop you from doing things has to continually increase. And, it seems that we're trained more and more to reach for the over-the-counter, painkillers, and some people get, prescription painkillers, and everything just leads to this whole cycle of mask the pain, live with the pain, mask the pain, live with the pain.
Mm-hmm.
And sometimes, of course you can find solutions. It just happens for myself personally, the solutions just didn't come from what's, deemed the traditional methodology. That was very frustrating.
So what type of treatment or programs did you pursue in the traditional sense that people might be able to relate to?
Sure. So from the very beginning, when I first got injured as a teen, I did they take you to the hospital, do the x-rays, and they look at it and they go, well, you got some bulging in your disc and you better just lie there for, a couple of weeks and stay on pain meds. And that was all right. I understood that. And then it just, as the years progressed, and the pain continued, I'd go for, one x-ray after another to a CAT scan, and eventually new words popped up, and, it started to show that I had facet disease and degenerative disc disease, and the treatments for that really are not too progressive in terms of they either look at it and say, we want to do surgery on you, or essentially you need to learn to live with the pain and reduce your activity. And so I went with, instead of surgery, I went with, the pain medications, and sometimes I would reduce my activity, yet the pain continued to keep on coming at me. I tried acupuncture. I tried tons of I can't even imagine how many hours of physiotherapy I went through, how many buckets of doing your exercises and having buckets of ice. I remember one time just, buckets and buckets of ice being placed on your back, and you just, okay, if we numb it, that'll reduce the swelling and reduce the inflammation, which makes sense, and it reduces the inflammation and you get some temporary relief. You're numbing yourself. And those kinds of things just, they were constant, trying the traditional, and then, at one point I even tried a fellow who, at first he said he was a chiropractor, and then I found out once I got in the office actually that, he does chiropractic, but he felt in my case that he wanted to do, at that point he said he was an energy worker, a healer, and I'm open to anything to release pain from my body.
Right.
And in that particular case, the results were dramatic when this fellow, I lay on his table and allowed him to just rub his hands he'd rub his hands together, place them on top of me without touching me, and move them across my body. And I let myself go, and the pain was gone. And I walked out of that office, and wow, I was like, man, this guy's a miracle worker. What I found out was that within 15, 20 minutes after being, totally released from pain, the pain would come back into my body. And I try that same thing, repeat it over and over again, where you go to others and you look for solutions and you find them temporarily, but the pain just kept on coming back.
Ah. So you can see that in your particular painful journey of 25-plus years that it starts with the frustration that you have the pain and there doesn't seem to be any cure in sight. Then it kind of moves on to a situation of disparity where you'll just reach out to anything that might help you kind of change the way you're feeling. And ultimately, it sounded like you came to a point of surrender where you just realized maybe this is just the way that I'm going to be living the rest of my life, but deep inside of yourself, you knew, yeah, there had to be a way out of this. And that's when you began to personally look inward. As you said, you're with this energy healer. You were in there, the pain was healed for a few minutes or, temporarily, as you said, but then it came back. Did you begin to see a different kind of a connection regarding the pain then?
Actually, at that time, I did not. At that time, that was about 15 years ago, my mindset was just being open to anything that could relieve the pain. I did not make a connection between how I was feeling, or what I was thinking about causing me not to feel pain. Because in my mind, I still was of the mindset that somebody else is doing something to me. I was still in that belief system that in order to be healed, you had to have others heal you, whether it's a medical professional or an energy worker, that you put your faith, your beliefs in the powers that others have. That the change, the shift to understanding that I have the power within to heal myself only came many, many years later. And that was the big, they talk about the big aha moment. The big aha moment for me was I was getting ready I had decided, after totally giving up on everything, including major surgery, the doctors, prior to the aha moment, I'd surrendered. I had been told that my condition was too far gone for traditional surgery, that essentially they could fuse 2 to 3 vertebrae, maybe 4 vertebrae, lose a huge amount of range of motion, but still have no guarantees that the pain would be reduced.
Mark, I find that interesting that you bring up the fact that the doctor gets you to a point, like an event horizon. They're pretty much just saying, this is the way it's going to be, instead of maybe changing that to give you more of a faithful belief to say, well, I'm sure there's a way to take care of this, we just haven't found it yet.
Well, okay, so I will give the doctor credit that he said something similar to that. But again, my personal perception was, all I listened to was, you're too far gone for traditional surgery. He did say, traditional surgery is not going to work for you. Perhaps in a few years from now, they'll have a surgery that could correct the situation. Mm-hmm. So it wasn't, it's how I perceived. I took what he at that time said to me was basically, you're done. That's how I hear it. You know how we all listen to somebody else, and it's amazing. You take what you want out of that. And exactly. I took his explanation was, you're done for today. Maybe tomorrow you might get lucky, but today there's no hope for you. Those are the words that I heard. Whether they're not verbatim the words, but that's how we are as human beings, is we listen to what we want to listen and discard the rest.
Oh, okay. So obviously something in you transformed, as I understand that you began on your path of self-discovery to become a practitioner of neuro-linguistic programming. Now, talk with us about what NLP exactly is and how you began to use that to nullify or actually get rid of your pain, as you were describing that there is a difference between emotional and physical pain.
Sure. So, the journey to finding out, what makes you tick, how you think, comes in different fashions. And for myself, I had a very positive experience with NLP 20-plus years ago when I got some Tony Robbins tapes. Are you familiar with Anthony Robbins, the motivational speaker?
Awaken the Giant Within, and personal power,
So, I mean, I thought, I was one of the millions of people out there who bought his tapes and applied what he was saying, and that helped at one point in my life refocus me on business and on different goal settings. And that was a good point in my life in terms of, I took responsibility for myself and I did something for myself. Now I'm at this later junction in my life where, my body seems to be failing me. And I thought about that experience and I said, well, what was it that made the difference for me when I did those tapes, 20 years ago? And I decided to research on what it was that Tony Robbins was, promoting or, teaching people, and I found out he had studied neuro-linguistic programming. And that's that was the base of his work, and of course he's gone on and learned other things and, expanded on that. But I said, okay, so if the base of one of the most successful motivational speakers in the world is NLP, well, perhaps I could learn what NLP is and how it motivates you, or how it can help you. So I found out that neuro-linguistic programming is essentially it's the study of the mind and how it works, what triggers different thoughts, and what triggers reactions in you. And it seemed very interesting to me because I said, well, there's got to be a way that I can use my mind to help myself. And I did it when I used those tapes all those years ago. Now if I go out and I study it, perhaps I can help myself. And that was my first and foremost reason for going to study NLP, is to understand how the mind works. So I go and I sign up for the first, it's called the practitioner's training, which is the base level for NLP, and I take the course. And actually, let me backtrack just for a second. The aha moment that I talked about earlier that I didn't get to divulge was prior to going to the NLP course, they send you a pre-study kit. And so you read up on NLP and you listen to tapes and you discover different things about, NLP prior to going. One of them is an exercise in visualization and allowing yourself to place yourself outside of your body, if you will. Put yourself in the third-person perspective and get to understand parts of your past history. During that exercise, I was able to put myself in a place that was outside of my body. I'm lying there and I allow my mind to wander and I'm outside my body. And what I came away from that with was that during that experience, during it and immediately after it, I felt no pain. I couldn't believe it. I'm like, what? What is going on here? I don't feel any pain when just a few minutes prior to that, I was all tight and in pain. Mm-hmm. So the aha moment was, oh my God, it's how I'm thinking, what I'm thinking about at that very moment is directly related to the physical pain in my body. Prior to that, I really wasn't making the connection between what I was feeling emotionally was what I was feeling physically. So this connection, it later got much more refined as I took the course, and they explained during the course how, truly how we think affects directly everything in our lives. And on a conscious level, you think you know that. You're like, well, sure, I know that what I'm thinking about is what's making me tick, what makes me who I am.
Mm-hmm.
But on an unconscious level, I had no idea that my emotions had become so suppressed and so hidden that they were hidden in my body physically. It's just a situation where it's very, very difficult to accept that truly what you're thinking can actually hurt you.
Ah, well, I can see how that could be true too. So, especially as you maybe take an inventory of your life and the things that bother you, and you realize that you stop thinking about those things on a conscious level, but at a subconscious level, they're very much alive and sort of sitting inside of yourself like a volcano.
Yeah. Absolutely. And the hardest thing for me to accept in the beginning, as as I'm taking the course, things are getting better, but I still come back to this. You can look at my CAT scan or my MRI, and my discs are shot. My vertebrae, the stenosis, which is the narrowing of the spinal canal. I mean, every single doctor who's ever looked at my CAT scans looks at my spinal canal and says, there's no room for your nerves. So no wonder you're having sciatic pain all the time, because there's just no room.
Mm-hmm.
So how can it be that I have these physical deformities, physical diagnosis, yet it's happening that every time I control my thoughts or change my thoughts, I'm able to alleviate the pain. Yet the physical ailments are still there. I'm not asking you, Daniel, to answer that question. I'm just, it's like, that was so puzzling. No matter, in the beginning, it was like, we do all kinds of exercises that help you deal with emotional stresses in your life or help others deal with it. And, the weight starts to lift off of you. I mean, we've all experienced this when you have something stressful in your life weighing heavily on you. I mean, we talk about it in those terms, weighing heavily, and your body, you feel physically that you're drained and you're stressed and you're feeling sick. Well, you're feeling all those things. You are feeling all those things, and you are causing those things. It's not the people around you. A lot of times we feel that, that other person is making me angry. That other person is making me upset or fearful or whatever emotion you're feeling at the time. But what we're trained in neuro-linguistic programming is actually, it's not the other person making you feel anything. You are choosing to feel the emotion in that moment yourself.
So now in your book, Release the Pain, Heal Yourself, what is the process? And share with our listeners what they can do right now as they're listening. Obviously, picking up the book so you can go through the process and learn to understand it better and work with it would be ideal. But give a couple of tips right now what a person can do that they can follow this process and release this pain, because it sounds to me like you discovered in your aha moment that the pain wasn't physical, although that's what we think it is, but it actually seemed to be more emotional. And to me, it makes a lot of sense that people are living with more emotional pain than physical pain, even though the physical pain is the end result of that emotional turmoil that they're feeling. So let's talk about the process and what people can do to be able to heal themselves.
Sure. First and foremost, it's it truly is getting in touch with yourself. And what I mean about getting in touch with yourself is pretty basic things of learning to listen to yourself. Every time you feel a negative emotion, something inside of you is being ignited. Yeah, like if you feel something that's just overwhelming, you're sending messages from your brain. You are creating these chemical signals that then transfer to every single fiber, every single cell in your body. So if you can start to get in touch with yourself and realize that as you are thinking of something that at the moment feels completely negative, you are now triggering off a series of, and I'll say, triggering off a series of explosions inside your mind that then transfers that energy throughout your body. And it's physical, it's visceral, it's those signals, that impulse that comes into you, that reaction that you have to something that's happening externally in your life happens internally. So
I think what's amazing too, Mark, just on hitting right on that, is the fact that you think causes a real reaction even though the thought isn't real, so to speak.
So there you go. Oh boy, we could get into a big philosophical discussion about that one, because what is reality, right?
Exactly. But anyway, so
okay.
but the idea is there, it's like you thought this came from somewhere, but then it created a reality within yourself that has a chain and, as you said, a chemical reaction throughout the body.
Correct. So here's a suggestion. So for any listener who's dealing with chronic or acute pain, I definitely don't have the answers. What I can say is that give yourself a chance to listen to yourself. Learn to take the focus off of your body and the pain that's trapped within it. You want to focus on your mind because it's what controls your body. You want to shift your emphasis from rebuilding your body. You want to just shift. Up until now, most likely, people who've been dealing with pain issues, the focus has been on their body, not on their mind, on how they think. So give yourself a chance, give your body a chance by saying it's okay to feel pain. If you're on prescription drugs, you have to check with your physician. If it's over-the-counter drugs like ibuprofen or aspirin or any number of things, my recommendation, again, if you have a medical practitioner, you have to check with them. If you're just like many of the millions of people who just are popping ibuprofen just to mask the pain, try and live without it. And actually, when the pain comes on, feel the pain.
Mm-hmm.
And why do I say that? It's because while you're feeling the pain, you're going to start to ask yourself some questions. Because during that moment when you're feeling the pain, the physical pain is most likely the moment in your subconscious when another game is happening.
Right.
So if people are listening and you have something you can write down this, because these few questions is all you need to do in the beginning. When the onset or you're in the throes of pain, ask these questions. First, what emotion am I feeling? So when pain rises up, no matter whether it's intense or dull, if the pain is there, ask yourself, what emotion am I feeling? You can ask yourself, what is my body saying to me? What is my body saying to me? And finally, ask, why now? So as it's happening, you're going to ask, what emotion am I feeling? Give yourself a chance to feel that, understand the emotion that's coming. Think about it and go, what is my body saying to me? Why now? You can use all three of those questions during the course of the pain, or you can use any one of them, or you can use anything that feels comfortable to discover what emotion you're feeling during the pain. Because if you give yourself a chance and you listen to yourself, the odds are high, if you continually practice this series of questions, that emotions will start to surface, and you will start to see that there is a connection between the times that you're feeling physical pain. In your subconscious, you're actually feeling emotional pain. Now, you don't have to resolve the emotional issues. That's the good news, because most people go, well, okay, great. So I understand that during the pain I'm feeling angry or sad or fearful, whatever it is, in whatever their own words are. So that comes up. Now, do I have to deal with it? Actually, in order to alleviate the pain, to get the process starting, all you need to do is make the connection between the two. What's so important about making the connection between understanding that during that physical pain that you're feeling, you're also feeling an emotional pain, you're actually now starting to break a pattern, because previously you weren't consciously aware that during the physical pain you were feeling an emotional pain. And once you recognize that the two are connected, you automatically start breaking that connection, and the pain then gets reduced. It's the way your mind works. Your mind essentially has chosen to, if you will, hide an emotional pain from you by displacing that emotional pain into your body. Now you're consciously catching it, and it loses its power. It doesn't have the power to displace the pain without your conscious awareness.
And it makes sense too, Mark, because I know that in many years of reading different modalities, alternatives, and even mainstream traditional methods of healing, is that one thing that kept coming up in my reading, and even on certain shows that I've done, is that they say, doctors specifically have said that a very high percentage of people wouldn't be in the conditions they're in, but they are simply just due to stress. That a lot of the sickness is brought on just simply due to stress. That if they can find a way or understand that all they need to do is learn how to manage that stress, outside of a traumatic case, they really wouldn't need me.
Absolutely. Absolutely. If only we were taught this in school as a technique to help ourselves.
Exactly.
I mean,
seems there's a lot in school I wish they would have taught us.
I mean, just as important as learning how to give CPR, you got to learn how to give CPR to yourself.
Exactly.
Well,
again, for the folks out there, as we're running out of time, the book is Release the Pain, Heal Yourself. And our guest here on the Beyond 50 radio program is Mark Ribkoff. Quickly go ahead and go over the 3 questions when a person is feeling pain. that will help them get started on the path to releasing and helping release and get rid of that pain for good.
Okay, so as the pain rises up, as pain comes into your body, ask these 3 questions. What emotion am I feeling? What is my body saying to me? Why now? Now, at any moment, you can reinterpret these words into your own. To start with, try, what emotion am I feeling? What is my body saying to me? Why now? The key is to listen to yourself. And so eventually you'll start having this conversation. Every time pain comes on, you'll start having your own little conversation. You might say to yourself, what the bleep is happening right now? Or, you just, you'll start to get it. Because once you make that connection, the power of that unconscious thought that was triggering the pain is diminished dramatically. And if you continue to practice this on a consistent basis, it's, at first it might not seem like anything's happening, but if you consistently do this over the course of a few days, a few weeks, odds are pretty high your pain level is going to be reduced. And once your pain level is reduced, then you are much more open to understanding how your mind works. And hopefully you'll open yourself up to reading books about how the mind works, reading my own book. There's a wealth of knowledge out there, and it's just getting over that hump of understanding that the thoughts that you carry, the thoughts that you are holding on to, are contributing to the pain. I want to say this, that people with physical ailments, myself included, I have boundaries. I have limits. That, yes, I have all the degenerative disc disease and all the other things in my lower back, and sure enough, if I try and do something that I overexert my back too much, I'm susceptible to getting a pinched nerve. But it doesn't happen. I used to have sciatica in my, right down through my legs into both feet constantly without lifting any weight. Now that I have this under control, the sciatica, it can get irritated. Yeah, if I pick up a 100-pound bag of cement, well, maybe I shouldn't be doing that.
Use a little common sense, too, as you're working with the mind.
Yeah, if my kids do it,
Well, the book, Release the Pain, Heal Yourself is the book, and our guest with us today, Mark Ribkoff. And Mark, we want to thank you for joining us on the Beyond 50 radio program today. Is there a website people can find out the process, find out more about your book, and things they can do?
Sure, Daniel, thank you. They can go to, my website is vitalmindbody.com. That's all consecutive words of vitalmindbody.com. It's available through my website, and it's also available on Amazon.com.
Well, very good. Again, Mark, thank you for joining us on the Beyond 50 radio program today.
Thank you so much, Daniel.
You bet. For the listeners out there, again, the book is Release the Pain, Heal Yourself. Vitalmind.com is where he suggests to go, where you can find out more about it. After all, you don't really have to live with pain, and you can understand as you look into the power of the mind how your thoughts can actually kill you, or at least hurt you anyway. And as I was suggesting earlier in the program, many doctors have claimed that if people can just learn how to manage stress, aside from something traumatic happening to you physically, there wouldn't be really much of a need to go in there to take care of pain or sickness, because they said that a good high percentage of the people that come in to see them for ailments is a direct result of stress. Geez, how easy can get, and just think of the money that you'll save and the wisdom that you gain by pursuing this particular path of learning how to work with the mind. I want to thank Mark Ribkoff for joining us today here on the Beyond 50 radio program, and also for you, the listeners. If you'd like to send us any questions or comments about the Beyond 50 radio program, we certainly welcome those. just shoot us an email, beyond50@beyond50radio.com. That is the number 50. Also visit our website where we have plenty of information out there, one way or the other, whether you want to increase your finances, whether you want to find a new way to live, or actually help get rid of pain on your own, then that's a good website to go to as well. That's beyond50radio.com, the number 50. I'm Daniel Davis. Thank you for joining us today, and remember, live your day past halfway.